So lenvatinib is what we call a multi-targeted tyrosine kinase inhibitor. So it's a small molecule that attacks multiple signaling pathways that are essential components of the way cancer cells spread, grow and divide. And we've had a long association with this drug in Glasgow from the first in human studies, which I was one of the principal investigators for more than 10 years ago, and we followed his progress through subsequent clinical trials through to this phase 3 trial in liver cancer today. So this was a phase 3 data in patients with advanced primary liver cancer, hepatocellular carcinoma. And the trial design was in patients who were naive for systemic treatment, who would normally be treated with sorafenib as the standard of care. It was a one-to-one randomization between sorafenib and lenvatinib, with a primary endpoint of overall survival with a non-inferiority design. Once non-inferiority had been demonstrated, there were a number of secondary endpoints, including objective response, progression-free survival, and time to progression, as well as toxicity. The study met its primary endpoint. It demonstrated non-inferiority compared to sorafenib and also had a statistically better progression-free survival, time to progression and objective response rates. So the significance of this is that it represents an alternative option for first-line systemic therapy other than sorafenib, but with superior progression-free survival, superior time to progression and superior objective responses, and therefore we could extrapolate that to hypothesize that we can reduce the tumour burden in those patients who will then subsequently feel better. For 10 years now we've waited for another positive trial in primary liver cancer. Up until 10 years ago there was no approved systemic therapy. Sorafenib was the first and so far only approved therapy for first-line therapy in this disease. More recently we've had regorafenib approved as second-line treatment, and now we have a positive phase 3 study after, it has to be said, multiple negative phase 3 trials in first-line systemic therapy. And therefore I think this gives another option for patients considering a tyrosine kinase inhibitor, and with emerging data likely to come through in the next couple of years with immunotherapy in hepatocellular carcinoma, we'll be in the position of having several options potentially, and where we'll be able to look at optimal combinations and optimal sequence. We can therefore speculate that we will have multiple approved therapies in the future, and the field will then have the challenge of trying to look for the best combination and the best sequence of drugs that we can use, both to improve survival and to improve quality of life and minimize toxicity, all of which matters to patients.